Here from this weekly news briefing, this is Matt Constantine, the Director of Kern County Public Health. We're set to get those latest numbers.
Good morning. My name is Matt Constantine. I'm the Director of Kern County Public Health. I appreciate you coming this morning. We have an expanded version of our twice-a-week briefing where we want to talk a little bit more about what the county and city and some of our hospitals are doing to prepare for COVID-19. And it is my pleasure to introduce Supervisor LETICIA PEREZ, the chairwoman of the Kern County Board of Supervisors.
Thank you, Mr. Constantine. Well, as you know, on March 16th, the County of Kern declared a Level 1 state of emergency, which moved the county to an essential staff-only model until April 14th. Some county agencies are still operating, and those include Public Safety, Aging and Adult Services, Animal Services, Elections, Human Services. On March 27th, Governor Newsom issued an additional executive order that expanded on a previous executive order, further protecting homeowners and tenants from eviction during the COVID-19 pandemic. This order bans the enforcement of evictions for renters and homeowners affected by COVID-19. The order prohibits landlords from evicting tenants from non-payment of rent and prohibits enforcement of evictions by law enforcement or courts. It also requires tenants to declare in writing, no more than 7 days after the rent comes due, that the tenant cannot pay all or part of their rent due to COVID-19. The tenant would remain obligated to repay full rent in a timely manner and could still face eviction after the enforcement moratorium is lifted. The order takes effect immediately and provides immediate relief to tenants whose rent is due on April 1st. You're still expected to pay the rent if able, but your landlord cannot remove you if you cannot make payments at the moment. Make payments at the moment. The Board of Supervisors would like to reiterate that we will follow the governor's orders and we will not force people out of their homes during this public health crisis. I can assure you that our county resources will be used only for essential services such as ensuring their health and well-being. I implore you to please take serious your health and well-being, the health and well-being of your family. Please follow closely the orders of the governor and, of course, the direction of the county as we can get through this quicker and safer together, certainly when we're united. Thank you so much.
It's my pleasure to now introduce the mayor of the city of Bakersfield, Karen Go.
Thank you, Matt, and thank you to all of the dedicated people in our community who are just serving, coming together during this special time. We hear the word extraordinary used repeatedly to describe this hour. Extraordinary times, extraordinary changes, extraordinary steps, extraordinary precautions. But never has there been a time in which there's a greater need for extraordinary unity. The seriousness of the COVID virus has drawn us together in a way that we've never been together before. City, county, east side, west side, red, blue. Those distinctions become irrelevant in this hour when we need each other, when we really have to come together. And it's been a joy to see that we really are working together. We're interconnected. I'm in a group text with hospital executives and our state legislators. And I get to see how the hospital execs are supporting one another, how they're collaborating so closely, and they're checking to make sure that everyone has the resources that are needed. Last Saturday, Ken Keller, who's the CEO, president of Bakersfield Memorial, texted that he needed masks. And immediately, Charlotte Briggs, CEO of Adventist, responded, "How many do you need, Ken? I'll bring them over immediately." She herself would take those over. That's the type of cooperation that we're seeing in our fantastic community. The mayors of California's 13 largest cities and our staff, we're cooperating, we're talking on a regular basis. In fact, we have conference calls almost nightly. We're highlighting those issues that really need to be addressed, and then advocating for our cities with the governor's office. Sharing what we're learning, we're sharing solutions. I'm so grateful that my office has a direct access to the White House, a direct access to our congressman's office, and they are reaching out to us. So if there are needs here, we're able to communicate those quickly. I'm frequently asked, are we prepared? Are we prepared? Everybody wants to know that. Public health, our local health officials, our local health providers, we've been preparing for this for years. It's not something that you just do overnight. They are prepared and they're ready. And I find it so reassuring, just personally, when I get to hear the internal conversations, those discussions with our healthcare providers, and it's apparent that plans are in place, supplies are stored for this, and they can expand their services when the demand is there. They're ready. The same holds true for our city, for our county, first responders, for our other personnel. And you're going to hear more about the specifics from our city manager and our county administrative officer. Do leaders have all the answers right now? Of course not. But I am confident that our leaders know where to get the resources to consult with experts, and they're prepared for this hour. We're in this together. So what can we do as a community? Please listen to our health care experts. Not the experts on social media. There are certainly many experts out there. And I ask our physicians and our hospital leaders on a regular basis, as mayor, what should I message to our community? And repeatedly they say to me, you've got to send that message, stay at home. Every time I ask that question, it's the same thing. Stay at home, wash your hands. They say, I can't say that enough. And so today, as the mayor of Bakersfield, I'm imploring our community, stay at home. Stay at home for yourself, for your family, for your friends, for our community. Unless you're providing or obtaining essential services, stay at home, wash your hands. If everyone does his part, her part, we can save lives and we can limit the impact and duration on our community. This COVID virus is extremely serious. It's contagious, and we need everyone to follow the guidelines. But there's another thing that we need that's also contagious, and that's hope. Let's be a beacon of hope to one another. Let's care for one another. Let's encourage one another, and let's create that atmosphere of peace and of calm. We're in this together. We will get through this together. Thank you.
Okay, I want to talk briefly about some of the current statistics in Kern County and in the nation and the state. In the United States, as of March 28th at 4 p.m., there was 122,653 cases, and there were 2,112 deaths. In California, as of March 27th at 2 p.m., there were 4,643 cases and 101 deaths. In Kern County, as of this morning at 10 a.m., there are 59 cases in Kern County, positive COVID cases, plus our one non-resident and our one death. As far as testing goes, as of this morning, we have 1,005 negative COVID tests. We have 930 pending COVID tests, which brings us to a total of 1,995 total tests if we include the positives in that. So there were 59 cases out of the 1,995 tests that were conducted. And as we reported last Friday, there are 7 of those positive cases that at some point during their illness, they were hospitalized. That number is updated every Friday. This morning, we have proclaimed a local health emergency for Kern County. This proclamation will be on the Board of Supervisors' agenda tomorrow for ratification, and this proclamation of a local health emergency accomplishes several goals. The first off, this gives the authority to issue orders related to communicable disease control. It also allows the ability to implement plans to work with partners to ensure targeted populations have access to health care, medications, and equipment to control the outbreak. And finally, this ability allows us to access resources from the state and federal government. Our Public Health Department Operations Center that we've spoken about previously remains in full operation. They work 7 days a week. We have 20 dedicated members that are in the Operations Center. We have approximately 10 additional individuals answering calls now 7 days a week. And we are providing daily guidance for first responders, for hospitals, for city administrators, for employers and businesses, for parks and funeral homes and churches, and to schools. We also have been receiving a lot of calls about businesses that have not been complying, businesses that have remained open. Of course, the far majority have heeded the governor's recommendation and have closed if they're not essential. But for those that have chosen to stay open, last week we sent out health inspectors to every business that we had received some sort of complaint on. These are businesses that we permit and also businesses that we don't, asking them to heed the recommendation from the governor. We left handwritten notices to every business that we strongly encourage that they comply. There has been and continues to be a lot of interest in the personal protective equipment. I have some statistics I want to briefly show you or tell you. So since March 13th, we have filled 100 resource requests with 27 additional requests pending as of today. We have distributed more than 100,000 N95 masks. We have distributed more than 87,000 isolation masks, more than 13,000 gowns, almost 2,000 goggles, about 9,700 bottles of hand sanitizers, and about 260 boxes of gloves. We have and we maintain a supply of PPE for our community. We have now submitted 6 separate resource requests to the state asking that they replenish the PPE that we've handed out. We have approximately a 2-week supply on hand given the current use. We're optimistic that the state will fulfill those requirements, and in fact, we have another order actually arriving today. On testing, on March 20th, the California Department of Public Health released testing recommendations, and this is important for our community. They've identified 5 groups that should be tested. Those that are hospitalized with symptoms of COVID-19 should be tested. Residents and staff of long-term care facilities with symptoms of COVID-19 should be tested. Those at high risk for severe infection with symptoms of COVID-19 should be tested. Residents and staff of correctional facilities with symptoms of COVID-19 should be tested. And finally, healthcare personnel with symptoms of COVID-19 should be tested. The state has been very clear to say, though, that those persons with mild respiratory symptoms who do not otherwise need medical care and are not in one of those mentioned groups should not be tested. These people should care for themselves at home, and that is the guidance from the California Department of Public Health. You're going to hear in a minute from Russell Judd, the CEO of Kern Medical, and he's going to talk a little bit more about this. But we have been notified from the state that there are 15 trailers that are being sent to Kern County to help us address the homeless population that are either suspected of being a case of COVID-19 or tested positive, this would allow stabilized housing for these individuals during their treatment time. These trailers are en route. We've identified the fairgrounds, and we've been working with the fairgrounds to assist with their placement. And Russell will tell you a little bit more about how Kern Medical is going to greatly assist with that effort. In addition, we have established an alternative care site. This is a definition that's used in state government to help hospitals that may become inundated with patients to provide additional resources. So if all 10 hospitals were to receive patients that were beyond their ability to take admissions and ICU patients, we need to have an ability to care for those individuals that exceed those capabilities. So this alternative care site is now being provided. It is being established also at the fairground. They're being set up in 250-person increments in separate pods that would be established to allow for this to occur. And finally, I want to mention again, as the mayor did, that there are two main areas where we need help from the public. When we start to look at modeling that's being released from the state, social distancing plays one of the most dramatic impacts on flattening that curve, on reducing infections, on making a difference in individuals' lives. That social distancing component is significant, and we want you to make sure you heed the governor's recommendation to stay at home when you're sick and stay apart. And as the mayor also said, simple hand washing dramatically reduces your likelihood of disease transmission. Okay, with that, I would like to introduce Russell Judd, the CEO of Kern Medical, to provide his comments.
Good morning. Let me first share with each of you the confidence that I have as a leader in the community as well as a person of our hospitals and our healthcare providers. As the mayor mentioned, we have been actively working very closely together across all the hospitals in Kern County. We're prepared. We have confidence in our medical staff, in our nurses, in our technicians. We know that we'll be able to step up and meet the needs of our citizens and the community during this crisis. One of our first efforts that we put forth, of course, is to protect our workforce. The physicians, the nurses, all who work in healthcare, whether it be at an individual physician's office or in a hospital, we have to keep them healthy. If our workforce becomes ill, frankly, there's no one left to provide the care. And so all the hospitals have united together to establish policies, to establish plans, to keep the workforce healthy. Those who work on the front lines of healthcare, they're very concerned because they're exposed at a significantly greater risk than other individuals. They're concerned about them receiving the disease and even more significant, taking that disease home to their family. And so we're united together in making sure that our workforce, those who will provide the care, are kept safe. We've done that first and foremost by the essential personal protective equipment, or PPE. As Matt mentioned, the health department has been very helpful. All of the hospitals have gone to extreme measures to secure additional PPE so that our workforce can remain safe. Policies have been drafted, the appropriate level of care and how to provide that. We've also adjusted visitor policies. It's necessary for us to limit the visitors that are coming into the hospital. Being in a hospital is a scary time. Your family is important to you, but it is important that we keep people distanced from each other and we're keeping people safe. There's a lot of do this and don't do that that's out there, but please know that the healthcare providers have come together. We're unified in ensuring we're doing all that we can. We have also all developed a very significant and detailed surge plans. The governor has asked that every hospital develop a plan where we can take 40% greater the number of patients than we do on a regular basis. Each hospital has outlined that plan. It is necessitated first, what location will we have the patients in? Where do the physical beds come from? Where does equipment come from? How does we support everything from the laboratory tests to feeding those patients? Those plans have been developed. They are in place. Again, I express my confidence in all of the hospitals to be able to execute on their plans, to be able to surge when that time comes and if it's necessary for the overall health of our community. That will take hard effort. It's where do we get all of the staff from? There will be a great spread of resources, but we are confident that we'll be able to handle that additional capacity. And of course, as Matt mentioned, if we get even beyond that 40%, we will have and work closely with Public Health Department and all city and county officials as we do what we kind of call our supermax surge if we move forward. Let me make a quick comment on help for the homeless. As is mentioned, if somebody has this virus or is being ruled out for this virus, they need to be kept away. They need to be isolated. We work closely. We have identified these trailers where this isolation will be able to occur. We will have a healthcare provider on site. We'll provide the proper level of security. They'll be able to be fed. We will have the necessary wraparound services. We've established a telemedicine process whereby individuals will receive both physical and behavioral health services via telemedicine so that the proper care can be provided. That will keep individuals who have these exposures from just being out and about or being in shelters or being other locations where they can spread this disease. I will again reemphasize social distancing and or isolation. If an individual has symptoms or if you've tested positive, isolate yourself. It's hard to be alone, but even separate yourself from your family, move to the spare bedroom, allow yourself to heal and stay away from people, and then for the rest of us, wash your hands, wash your hands, wash your hands. Anytime you even think about how am I going to get through this, stand up and go wash your hands. Anytime you touch anything, we've all been up here touching this podium. As soon as we're done, I'm going to go wash my hands. Wash your hands, wash your hands, wash your hands is the single biggest input to keeping yourself healthy. This disease is droplet spread, and if you keep those droplets off your hands and then out of your face, you'll go a long way in protecting yourself from this virus. Again, I want to assure you that we've got confidence in our healthcare providers. Physicians are capable. We have leading infectious disease physicians in our community. We know how to treat the disease. We know how to care for patients. We will be prepared, and we'll be able to meet the needs of our community on the healthcare front. Thank you.
Thank you, Russell. I would like to now introduce Ryan Alsop, our Chief Administrative Officer.
Good Monday morning, everybody. Just some updates from the county. March 16th, as most of you know, we declared a countywide local emergency and implemented continuity of operations planning, moving to essential staffing only across all county departments through the 14th of April. We've not yet announced extending beyond April 14th, but it's highly likely that we will in the coming days, given where things are. And we'll be making that announcement again in the coming days. County buildings are closed, again, with the exception of essential services only. Residents can go to kerncounty.com to find out all about the essential services. They're right there on the front of the homepage. Our EOC, our Emergency Operations Center, which is run by our fire department, it is activated. It has been since our declaration of local emergency. It's activated in support of Incident Command, which is Kern County Public Health. Our Public Health Director and his staff are in charge of this incident. Our Emergency Operations Center, which is staffed with a small but highly mighty staff and capable staff, is operating in support of public health in their management of this incident. We hold daily calls with people all over the county, all the city managers regularly, all the PIOs in all the cities regularly. school districts, etc. It's a very rigorous operation, daily briefings from public health, and then those briefings are put out and disseminated, and we're all coordinated and working together as one county. We also remain, our EOC staff remains in contact with state OES leadership on this emergency, and we're coordinated there as well. Residents throughout the county who do not have access to the internet, if you need access to the internet during this extraordinary time, you can go to a local Kern County library branch where you can access it for free. Now, the library's closed, you can't get in the building, but you can access it from the parking lot. So if you are in need of internet access and you don't have it at home, you can get free Wi-Fi access at all Kern County library sites. They are hotspots in communities. If there is not a Kern County library in your community, you likely can get the same signal free from a county building. Any county building that is in your community, think of that as a hotspot. We continue to assist other organizations in our community with help, whether that's helping provide extra space to groups like CityServe, where they're getting more equipment and supplies, emergency supplies brought in, whether it's giving them a free warehouse to keep that, or working with Mary Barlow to try and figure out the digital divide in this county, which is a real thing, or the Bakersfield City School District, helping them distribute food to students in the southeast part of this city, or working with our city manager, the city of Bakersfield, to figure out how we address homelessness, both in extraordinary times like this one and in normal times. And simply put, we're a team working this together, and we support one another. I want to thank county employees. Our county employees have tremendous responsibilities, and I want to thank our essential service workers for everything that they're doing during this time. Thank you for staying committed to your jobs. Thank you for responding in emergencies, for protecting us, taking care of us, and doing work many of you, most of us can't even fathom doing, frankly. You're all heroes. I appreciate it very much. Thank you for your support. Hang in there. We're not forgetting you, and I'm not forgetting you. And lastly, folks, if you can, please support our local restaurants. Order some food, have it brought in, have it delivered, practice social distancing, go pick it up in your car. They have measures in place. But our local restaurants are the soft underbelly of this economy. They're the first to feel it. They employ lots of folks who are out of jobs. I have family in the restaurant business. I have family members who park cars for a living. They're all out of their job. So where you can, please, enjoy a meal at home. Order. You can go online and figure out who's doing what, but support our local restaurants to the extent that you can. And with that, thank you.
Thank you, Ryan. I'd like to now introduce Christian Clegg, our new City of Bakersfield City Manager.
Thank you, Matt, and good morning, everyone. I recognize that these are challenging times for everyone in our community, and want to reiterate that we have and will continue to work very closely with Kern County and with public health on this challenge. I want to point out that the city has already taken significant steps to make adjustments in our operations in response to this state of emergency that we have declared, as well as the governor's stay-home order. Several weeks ago, we canceled or postponed all large events, as well as social gatherings. We canceled our non-essential community meetings, as well as we're taking precautions with our internal city employee meetings. We've closed all of our recreational facilities and sports complexes, and we worked hard to reduce our staffing and be creative in flexible scheduling to practice social distancing for our employees. We have done all of this without negatively impacting our most essential of services, and that's a key message we want to continue to deliver to the community, that our police and fire response, our trash, sewer, and water services will remain intact. We're providing our employees also with their personal protective equipment. We thank our employees for continuing to provide these very essential services. And as the county pointed out earlier, we had announced these adjustments through April 14th and will likely extend beyond April 14th as we see those guidelines come from state or federal partners in this. But I think the last message about maintaining our essential services again is that if you need us, the City of Bakersfield will be there for you for these most important of services. We're working also closely with the county, the Chamber of Commerce, and Kern Economic Development Council to respond to those businesses that are facing challenging times and fiscal distress, and individuals that may have been employed by those businesses that are doing the right thing to close. So there has been launched a business response team that businesses can go online and seek out support and answers and services, as well as a hotline number that will be provided on the city's website and those partners' websites. It's also important to note that the city will be looking to allocate emergency homeless funding coming from the governor's office to support the efforts in partnership with the county and public health for this very at-risk population in these tough times. And while we continue to encourage individuals to seek answers from public health as the lead on this issue through their hotline and website, the city has also created a specific website related to our impacts to our services, and there are answers there about city operations as well as resources that many of our partners have provided that we've linked out to individuals. This is definitely an issue that needs to be taken seriously, but know that we are prepared and that we're working together in unison to manage this. We are together and we'll get through this together. Let me reiterate, though, that it will take everyone doing their part, and I want to comment specifically about parks. We're asking everyone to please practice social distancing in our parks. Because this has been somewhat of a challenge, we're going to begin to increase our signage and also some minimal barriers such as caution taping on our playgrounds and other parks equipment to again reinforce the need for social distancing in our parks. We know that we need some outlets during this time to go get some fresh air, and that's important, and so we want to keep our parks open for the community, but we're please asking everyone to social distance while in the parks so that we can keep this amenity open in this important time. Please follow the governor's stay-home order as much as possible. If you do not work in those essential services, stay home. If your business is not on the essential services list, please close. But as the county administrator pointed out, there are good ways to support our local businesses while practicing social distancing, and we encourage the community to do so. Use common sense. Make responsible decisions for our community, and that way we can save lives and we can do what's right for everyone. So again, stay home where possible, work together, and save lives. Thank you.
Thank you, Christian. And then finally, I would like to introduce Dr. Mary Barlow, an integral partner with us at Public Health, our Kern County Superintendent of Schools.
Thank you. Good morning. What you've heard today and what we've experienced over the past 2 weeks is just a remarkable collaboration and sharing of resources with these amazing partners and many others across Kern County. And it makes me proud to be part of Kern County. Within the education sector, KCSOS, along with our 47 school district superintendents, are meeting daily on Zoom calls, and we are problem solving in real time. We are looking at specific issues, learning from one another, and adjusting daily as we stand ready to serve the students of Kern County. We are ready for any eventuality. Over the past 2 weeks, our collective efforts and focus has been on ensuring the 3 priorities that the governor outlined in his executive order. These priorities include continuity of instruction, and you might have been hearing quite a bit about distance learning. Our physical schools may be closed, but learning continues. Our remarkable teachers and support staff are working around the clock to create opportunities for students and families to learn together, whether it be in English language arts, mathematics, science, social sciences, as well as social emotional learning to help people get through this period of time. KCSOS has partnered with Canvas, which is the world's fastest growing platform for online school. And we have complete standards-based curriculum developed in all areas for grades TK through 12. And we are currently rolling that out in at least 15 districts across the county. Paper packets have been sent home with students because in some cases, especially the very youngest, it's very frustrating to get online and support a child as they navigate through this situation. Teachers are leveraging Google Classroom. They're using Zoom to meet with their students, and they are doing a remarkable job of ensuring that their students are receiving connection with one another and their teachers. In terms of technology, we know that up to 40,000 students within our county do not have access to devices or connectivity. We serve about 190,000 TK through 12. Imagine another 40,000 that are under the age of 5. 30% of those children live in poverty, and as a result, we are problem solving in real time to bring the needed devices as well as connectivity to our school children. Just this past week, we received 20,000 Chromebooks stored in our warehouse, and we are ready to deploy those to school districts that have requested additional Chromebooks for the students they serve. We have ordered and are in receipt of 5,000 MiFis, which will allow for connectivity throughout the county for those that do not have it at this time. Additionally, we have a common guest Wi-Fi network that has been set up at select school sites so that when students come to pick up their food, which I'll talk about in a moment, they can also download their packets and their electronic learning for the day. We have partnered with ALSOP and with the County of Kern to ensure that we have hotspots throughout the county for those who may not have internet connectivity at home. Kern High School District has 15 buses, Bakersfield City has 20, and Kern KCSOS has 5 buses. We are all outfitting them, and we are outfitting them to be MiFi hotspots that go out into communities where the connectivity is challenged. Therefore, students will not have to drive into a hotspot area. It'll be much closer to their home. Communications with families have been ongoing with regard to the offers that we've seen with Spectrum and AT&T to provide support for those families with low income to provide the connectivity that they need. Let's talk about meal service. That is one of the most challenging things that we have seen over this past 2-week period. Last week, we served an average of 108,000 students a day, 2 meals, breakfast and lunch. That speaks to the need within our county. And it is very gratifying for those of us who have been on the line serving this food, knowing that we're bringing absolutely necessary support, a smile, a welcome, and the concern that children have someone standing there making sure that they're going to get what they need. The number of children who come to receive meals in our schools is clear evidence that we're meeting that critical need. And it really showcases the incredible efforts of our food service workers, our other classified members, our administrators, and all school employees who are coming out to support the students they serve. Supervision during school hours is something that we're working on. I can tell you, as the governor has requested that that be provided within social distancing requirements, has created a bit of a challenge for us. But as we survey our parents, we're finding that many of them are not requesting childcare during the school hours. They are keeping their children home with them, they are keeping them safe, and they are ensuring that they are getting what they need on a daily basis from their teachers through distance learning. There are a few places where we know that we are operating that childcare because of the need of those folks who are still in the community providing essential services. And as those change, we will increase the number of support locations on an as-needed basis. So I guess I want to close with real sincere appreciation for the collaboration of all of the people in this room and many more who you've heard from today. It's important that we follow the guidance of our public health officer, Matt Constantine, that we use our own common sense, that we remain calm for our children and for our family members, and that we show love and concern and empathy for every person and what they're dealing with during this pandemic. Again, my appreciation goes out to the healthcare workers, the firemen, the policemen, and all the essential workers who are out in the community. I tell you, you are our first line of defense. Thank you.
Thank you, Dr. Barlow. That completes our formal comments from the press conference. We are, the guest speakers and I are willing to take any questions as a group, but then we'll be shortly available for any questions individually. Are there any questions that we can help with?
What happens when a business that you've told is not essential, what happens if they don't comply with what you've asked them to do?
Our hope is that they do comply. The far majority have. When we've hand-delivered those notices, they have all understood. There was some misunderstanding at times, and we've asked them to comply immediately. And for every facility that we visited that I'm aware of, they then subsequently shut down.
And what is a non-essential? Like is Home Depot or Lowe's or are those kind of hardware stores still okay to open?
Right. So the governor has listed and identified categories of businesses that are able to remain open and that are not. We've posted every one of those recommendations, and they're extensive, on the website so that we as a community can review those individual businesses.
And on that list, I didn't see gun stores as essential. I know our neighboring county, LA, the sheriff is deciding to keep gun stores closed. In this county, what can you comment on that?
All I can tell you is what is on that list. I know that's been of community interest. We've been interpreting those guidelines very carefully as we want to make sure everybody is protected. In relation to that one business, I don't have any further comment than what's on the list.
Matt,
Yes.
How many stores did your health inspectors make contact with? How many businesses, I mean?
So I have a list. There's approximately 30 or 40 that I'm aware of.
Throughout the county?
Throughout the county, yes, ma'am.
As far as the tests that are pending, what
Yes.
is your recommendation for them? Are they staying in hospitals because of the severity of their illness, or are they asked to stay at home during the pending part of the testing process?
So any suspect case that is then obviously being tested is under the care of a physician. So that physician will have provided specific information on how they are supposed to take care of themselves. In most examples, they should self-isolate until they have the results. But that's under the direction of their private physician.
How many weeks do you project before Kern County sees a peak? Is there a projection for that?
I don't have a projection today. The state has released some modeling information for us on Friday that we're still now looking at. And it does provide an ability for local communities to try to anticipate when the peak hospitalization when we'll reach that based on a number of variables. I don't have an answer today, but there is some information now coming down from the state that allows local communities to start to anticipate dates.
You mentioned that you guys declared a global health emergency.
Yes,
here.
sir.
And you were talking about some of the orders that you guys can now issue. Can you provide any specifics on what that would pertain to?
So we want to make sure that as a community we have all the tools and all the resources available to us in anticipation that we may see increasing numbers of cases and unfortunately those that might pass away from COVID-19. So we have these tools available. We want to make sure we have every opportunity available to help. At this point, as I mentioned, we don't have an imminent need. But we believe that there will be resources that will be available and additional requirements that we may have. So this is our opportunity to position the county well.
How will members of the homeless population be identified for those trailers?
So I'm going to ask perhaps Russell Judd to help us with this question.
Individuals who present at a physician's office, in an emergency department, or in a hospital, maybe even need hospitalization. When they need to be isolated, we go through a process to make sure that patient can self-isolate. Do you have a home? Yes, you can go back to. Do you have someone to care for? Yes, you do. If individuals respond to say, I don't have a home, or I come from a group home that doesn't have the ability to isolate, that is what they will be made available to. So it'll be people who are receiving active treatment under the care of a physician, and we will be able to place them safe for them as well as safe from the community.
Thank you. And what are the visitor restrictions now in place for hospital visits?
I can speak specifically to Kern Medical. No visitors are allowed unless it's in a maternal situation where you're giving birth to a baby. It's nice to have a partner there, as well as for pediatrics. Anyone who has a child in the hospital receiving any type of service, we allow a single visitor with them.
In terms of that maternal care, we've heard that there have been limits being placed on that, like if it's just a spouse or just one loved one. Is there a certain limit in Kern County?
Again, I can speak specifically to Kern Medical that yes, it is limited to a single individual to be there, which is hard, it's difficult. This is a unique situation. But someday, hopefully 20 years from now, that person will be so excited to tell they were born during the crisis and everything's still great.
In the situation at the fairgrounds, the facilities being set up for the homeless and in the event of this supermax surge, are those facilities already set up, being set up? Are you waiting to see if something happens and then the trigger goes off to set them up?
I don't know if Matt, do you want to take that one? He knows that better than me.
So the answer to your question is all of the above. We have worked with the fairgrounds to identify specific buildings and locations that we could provide a secured environment so that we can provide the best care to those that are housed there. We have some existing resources that we are going to be able to deploy to the fairgrounds. And then we will also have some unmet needs that we will likely look to our region and to the state to help supplement.
And is that just where they recover from treatment? Do they have to go to like a hospital first or some kind of medical facility before being transported there? What is that process?
So the operational component of the alternative care site, that's what I'll speak about, we are developing. We want to make sure we work with Russell Judd and his colleagues at the other hospitals to ensure that the patients that we see and the flow is the most efficient at helping the hospitals ensure their continuity of operation. Any more questions?
Just about the businesses,
Yes.
are there rules in place for limiting product quantities that aren't essential? Like, can people still buy as much as they want in certain items, or is it store by store?
So there are no restrictions or requirements at a county level.
And I think you addressed this before. Is there some kind of outreach team that goes to these the homeless populations that may not be fully aware of all the information coming in?
So I might again refer to Russell. I'm not aware of any.
So that is a clearly vulnerable and potential need in our community. So the Bakersfield Kern Regional Homeless Collaborative that is organized, many of us sit on that board. There's active discussions across the providers who regularly service those communities. They are very much aware of the situation that we're in, are working closely, trying to identify to keep that population healthy and direct them to where they can receive services.
And for Christian Clay, can we talk more about the parks, the signage, the kind of overflow that we're seeing?
Yes, our parks are a huge amenity, and many of our parks do not have fencing or other areas to limit access to those parks. But there is park equipment that we're seeing individuals congregate towards, and so we'll be using caution tape, wrapping, and signage to discourage the use of park equipment. Beyond that, we would like to, again, keep our parks open, as I mentioned, but we're asking the community to please use social distancing while you're in those open spaces.
And you're mentioning about essential, non-essential. I know, a lot of it has to come from state guidance, but for those businesses that, is getting the education from you guys and are not closing, what are the next steps that are going to be taken?
I think that question has been answered at this point from a public health perspective. We're in education mode, and the city is poised to support public health in their enforcement efforts.
Have you been receiving complaints about people congregating at the parks? Is this in response to that?
We have both noticed it as we have served the parks. We have parks maintenance crews that continue to ensure that our core facilities like restrooms are cleaned in our parks. We've noticed it, but we have also received complaints from the public, both through phone messages as well as we've noted it on social media. And because of both factors, we're taking it to the next step to discourage the use of our park equipment.
The local health emergency that was declared is separate and in addition to the city emergency ratified last week?
I would say it's a correct statement, but I would say that the city's declaration is in addition to the county's declarations, because the county, the city being part of the county, we're underneath the county's declarations, but the city also did the same to ensure that we were in compliance with the governor's definitions of essential service workers.
And these separate emergencies come with their own separate funds that are required and resources?
It provides us access to potentially apply for reimbursements and funding streams, yes.
I have a question for LETICIA PEREZ. Can you expand a little bit about how county resources won't be used for evicting tenants? I've had a lot of people reach out to me saying that they're still getting threats from their landlords that they will get evicted if they're not paying rent. So what can we talk about?
Well, certainly we expect confusion in these matters. So I can appreciate the stress that landlords are under, that property owners are under to pay their bills, and the confusion of what's happening, because the order from the governor is that evictions related to COVID-19 specifically. We do not need a backlog, if you will, of a stop on evictions when our courts open back up and when they do take these matters forward, which is standard operating procedure. It will occur, which is why the governor and others are encouraging people to pay their rent and mortgage if you can, to continue as business as usual, because these matters will proceed again when it's over. But in the meantime, if there are threats of eviction, if there's anything in writing, I would ask personally that people contact my office. I can be reached at 868-3690. My staff, Christian Romo, is also present. He will field those calls, and we will look into them. We will call landlords and work with them and help explain to them the very unique nature of this crisis and why it is immensely problematic for us to put more people on the streets when we know that social distancing is the only solution really that we have to curb this and get to herd immunity as fast as we can, to ensure that the least amount of people are harmed in this process. It's indiscriminatory. Perfectly healthy people are becoming very, very tragically ill and dying all around us. So this is serious. We cannot put people, and we should not put people, in more stress than they're currently in by telling them that we're going to kick them out onto the streets. It's just not right. And our institutions, our courtrooms, and our sheriff will not engage in enforcing any of those measures or really putting more of our workforce in a worse position than they're already in. But folks should understand that you do have to pay your bills. All of us have to pay our bills, and it will eventually come due. We just don't want people to feel they're going to be put out on the streets for the obvious reasons.
So the protections are in effect until the end of May. So does that mean that on June 1st, the tenant will have to pay for these missed months? or get evicted?
It's a great question. Again, it's a case-by-case matter, and I would encourage people to call our office so we can work with them and walk through the process and talk to the landlord and hopefully come up with a compromise that doesn't involve an overly litigious outcome, because the world is changing and each week is different than the previous one. When this is over, and it will be over, when it is, we will work through those matters as a community because it's important. Our workforce is important. People's emotional and mental health is important. And we are prioritizing that as a county by saying our resources are not going to be used to put people in further harm. But ultimately, we do expect to get back to normal. We just ask, beg, plead, implore the public, please stay home. It's not convenient for anybody, and everybody's losing here. But we have to minimize death and ill and harm to innocent people. We can do that jointly as Americans, and I'm proud to see that we're doing that in California and that our staff is encouraging people, please, let's take this time to pause and to consider our neighbors, consider the elderly, consider people with certain blood types that make them more vulnerable. I mean, it is totally arbitrary or largely arbitrary, and that's quite terrifying. So we should be united around that.
And does the county have any plans to help these people who come June, they're going to owe 2 months of rent and haven't been working, any sort of payment plan or anything that?
It's a great question, and we're working through those processes with the governor. I'm in regular communication with his staff to ensure that we have the systems in place when this is over to make us all as whole as we possibly can. Nothing's going to be the same. People will lose money and other investments, and it's extremely unfortunate. It's why we want to limit it to the least amount of time and damage as possible. So those questions and answers will evolve, and as they do, we'll be on the cutting edge, I assure you. And I ask members of the public that are afraid of pending homelessness, please call my office. We will call you right back, and we will work very closely with your landlord to work on a compromise that strengthens the fabric of this community and not tear at it. So, thank you.
I think there's one last question.
Yeah, for Christian Clegg, what can the business response team really offer businesses, and which businesses should we be met up?
Yeah, the business response team is there to answer questions from any business, really. It could be about what is considered essential or non-essential, trying to help direct them towards those resources. In addition, though, there have been resources that have been offered up by economic development councils, by the federal government and the Small Business Administration to provide a business continuity loan. So there are some links to resources to help support businesses, as well as just information for those employees or employers that may have experienced fiscal distress, so that they can share those resources with their employees to go and file for unemployment quicker than the standard process, as just one example. So it is a broad array of resources, and there's also the ability for businesses on the Chamber of Commerce website to post if they are open or if they are closed or if they have modified services. So it is a fairly broad range of resources that are available that we're just trying to help get information out to those businesses.
One more question. Sorry. Just one more question about gun and ammunition sales. You mentioned that there's a list of essential versus non-essential businesses on the city website. I don't see gun or ammunition sales on either of those essential or non-essential. Can you make any sort of clarification?
I have no further information. I cannot. And it's on the county's website, not the city's.
Sorry, that's what I meant, yes.
And Matt, just really quickly, you were mentioning the 5 groups
Yes.
That are eligible for testing.
Yes, as a priority, not eligible.
Okay, priority.
Yes, sir.
Okay, so if a resident has symptoms
Yes.
of these, they can still go
Yes.
and inquire about it.
Yes, they speak to their physician. If they're symptomatic, the physician makes a decision.
Okay, and I'm not sure if anybody in the room can answer this part, just to the gun sales here. The sheriff clearly said that this is an essential business. The district attorney agrees with the sheriff, saying the gun stores are essential business. The county deferred to the sheriff's comment. So I'm trying to understand it. If these officials in our county are saying that gun stores are essential, at what point is there going to be, a deciding factor whether they are or they're not?
I'm not in a position from a public health standpoint to address that question, and I'm not sure anybody here is. So I don't think there's any further information I can offer from my position. Okay, thank you all for coming. If there's individual questions, we'll be here for just a few more minutes. I appreciate your time.
We have Spanish briefing.
Oh, and then we do have Ellie here too.
All right, you've been listening to the latest update from Kern County Public Health on the COVID-19 crisis. The latest numbers for Kern County are such: 60 cases of COVID-19 here in Kern, 1 death, 1,005 negative tests. There are still many tests pending right now, and these are the latest numbers as of updated this morning. Again, Kern County Public Health has been updating those twice a day at 10 a.m. and at 4 p.m. So you can watch for more updates later this afternoon as they continue to receive those tests. Just to recap a little bit about what they talked about this morning, it was quite an expanded news conference. Kern County Superintendent of Schools Mary Barlow joined the public health officials along with Supervisor LETICIA PEREZ, County Administrative Officer Ryan Alsop, Bakersfield Mayor Karen Go, Kern Medical CEO Russell Judd, and Bakersfield City Manager Christian Clegg, just to name a few. They talked about different procedures that are going on around the county and the city right now, urging people to stay home and stay safe for their own health and the health of their families. They addressed, in particular, social distancing at parks, urging people and children not to play on park equipment, talking about ways that they may shut that down so no one's playing on that high-touch equipment. Basketball courts, tennis courts, those are also closed right now. You are still allowed to go to public parks, but you're told to do so in a socially distant way, so staying 6 feet away from other people who are at those parks. Kern County Superintendent of Schools Mary Barlow also talked about ways they're trying to get connectivity, internet access, and devices to students around the county who don't have it. She estimates somewhere around 40% of students don't have access to the internet, so they are setting up specific school sites as hotspots and talking about ways to use buses as traveling hotspots as well. And they've also just received about 20,000 Chromebooks they're going to use to try and distribute to local students who need those devices. Again, everything is changing minute by minute. Another thing that was spoken about by Kern Medical CEO Russell Judd, they've developed plans to handle a 40% surge in patients if it comes to that. And he's also in contact with other local hospitals as they all work to get together and make sure that we have the capacity to care for the number of people who could get sick here in Kern County. And one other key takeaway here, 15 trailers currently being sent to Kern County to help with the homeless population who may have or have been exposed to COVID-19. Those will be set up at the fairgrounds, so they are working to address the homeless population and the potential problem there as well. But again, the latest numbers this morning, 60 cases of COVID-19 in Kern, 1 death, and more than 1,000 negative tests. We'll have all of the latest from the news conference on 17 News at noon. You can, of course, go to our website, kget.com, and click on the coronavirus banner on the top of the page. And again, those updates from Public Health come out several times a day, in the morning, usually at 10 a.m. and at 4 p.m. in the afternoon. So download our app, 17 News, to get the latest numbers sent directly to your phone. From the 17 Newsroom, I'm Maddie Jansen.